if you are going to drain either a regular blister that looks like it has blood in it, or if they've got a bloody toenail, there are some people that say you shouldn't drain a blood blister because there's a little bit higher chance of having infection. But if they're having a lot of pressure from it, it is okay to drain just like you would any other blister. You would just take, but you would put gloves on because you might contact the blood. Take the safety pin, poke it through the superficial skin on the blister, try and leave that superficial skin, drain the blood out, and sometimes just grabbing a little 4x4 gauze or a 2x2 gauze to drain the blister, push it down, and then put this tape over it just as I'd done before. But if that is underneath the toenail, basically you'll need to put a hole through the base of the toenail in order to release that fluid. There's so much pressure in there, that's what causes a lot of pain. And sometimes in the ER they have a little tool that can do that, but since we're not in the ER and we're out on the course, actually if you just take a needle, this is a 22 gauge needle, a bigger gauge works better. I usually use an 18 gauge or maybe a 20. Take the top off. Don't worry, I'm not gonna poke you. What you'll do is just put the base of the needle the point of the needle right at the base of the toenail, and that's usually where you can see a lot of the blood collecting. And then you just hold it and spin with a little bit of downward pressure, and that will drill a tiny little hole into the nail. Now, because there's fluid underneath, if you push too hard, you're gonna jam it through. But if you just have a little gentle pressure and spin the needle, you will go through and the pressure will start to release before the needle point actually hits the skin underneath, because there's that layer of fluid between the nail and the skin. And once that layer of fluid is starting to release, then the pressure comes down, the pain goes down significantly. In general, runners can avoid getting those types of blood blisters underneath their toes if they cut their toenails short and file them down, so that when you put your finger coming back the other way, you don't catch on the toenail. So what causes that is just the toe running into the front of the shoe and all this pressure pushing at the front of the toenail, and it transmits down to the nail bed that ends up causing a blister. Then once you've done that, you would do the taping that I showed you before, once over the top and once around, to hold the toenail on so it doesn't rip off. Eventually the toenail will come off. There's no way to save it once you've had the subungual hematoma underneath it, but you want to keep it on for the rest of the race because it'll be tremendously more comfortable with the nail still on the toe.